Okay, I'm going to be explaining to you about the ostomy. You need to gather your equipment. This is a stoma site right here. Now people don't usually have two stoma sites, but this is to show you different sizes. And we are going to put a bag on this one here. So first we need to get our template right here, which measures the size. And you hold it up and you find the correct measurement. You don't want it to be really big like this because when the bowel comes out, you don't want it to be all over the skin. And you don't want it to be really snug because it will irritate this area. So you want it to be about 1/4 to about an 1/8 inch larger than the stoma here. So once you get your size, then you're going to take this thing here that's called a wafer, and you're going to draw on the back of this wafer and cut it out so it's the right size. So this size should fit your stoma at this point. So remember, this is the stoma, this is your template. You measure around it 1/4 to an 1/8 inch, and then you get your wafer the right size, and then you attach your bag to the wafer, and your bag will have a clip on it, and then you're going to take the adhesive off the back of your wafer and you're going to hang it on the patient where it's hanging down and out. Now most of your bags are clear, and so it's easier to make sure that you're hanging it in the right place. But if need be, you can put the wafer on first and then the bag. But most of the time, initially, you can put them on together. So this is how you put your bag on. Okay, I'm going to also show you guys how to do an irrigation, and you're going to take your bag off. And this bag, by the way, is fan folded and then clipped. And one thing about that you should remember is these bags can also fill up with air, with gas. So if it does, to avoid the bag exploding or breaking, you have to have some sort of release. So you either need to take the clip off and release it out of here, or kind of burp it this way like a Tupperware lid. But if you do that, make sure that you burp it away from yourself, away from your patient's face, because it's not a very good smell there. So keep that in mind. Take this off. You're still going to have your wafer on, and this is if they need to irrigate the stoma. So what you're going to do is attach your bag to the wafer, which will be on them. And if your patient can get up, let them get up and go sit on the toilet and hang this down, not in the water, but hang it down so where it drains into the water. And of course you're not going to have to be holding that because it's hooked on there. All of this, by the way, should be done with your gloves on when you're doing this with an actual patient. And then at this point, you're going to take a bag that looks something like this. I'm going to put this down for just a moment. This bag needs to be filled up with approximately 1,000 to 1,500 cc's of warm water, about 105 degrees. And then after you finish filling it up with water, put some soap in it, Castile soap, which should come with it, and kind of swish the soap around a little bit. If you put the soap in first and then the water, then it's going to be really bubbly like a bathtub, and you don't want that to happen. And before you irrigate, you also want to open this up here and prime your tubing, which means getting all the air out of your tubing so you're not putting a tubing of air in the patient before the water gets to them. So then clamp that off. You've got your bag up here. And you will put this cone right here into the bag. You don't want to twist it in the stoma. You want to just have it, hold it there gently, and then you're going to have your solution going, and it might take 200 or 300 cc's, maybe not very much. Then clamp it off, and you see how it's a little awkward here holding this up like this? If you have an IV pole, you can just hang it on the IV pole and it'll be a lot easier for you. Now you can take this out, and it automatically, because there's not a sphincter, it's going to drain down into the irrigation bag. And just let them sit there on the toilet for approximately, I'd say 15 minutes. And then at this point you can seal the bag up, and clean the end off and fan fold it back and forth and clip it, or fold it in half and put a rubber band around it to keep it from coming undone. And you can just let them wear this for an additional 45 minutes, making it a total of an hour. That way you don't have to keep changing the bag out every time it fills up. The reason I told you to have them only sit on the toilet for 15 minutes is a couple reasons. When your patient or yourself sits on the toilet without your buttocks being supported for a long period of time, because there's pressure of your body, because of the gravity, you're more at risk for, or your patient is more at risk for hemorrhoids, and you don't want that, and they're more at risk for vagal stimulation because of the pressure pressing down. You're more likely to stimulate the vagus nerve, which causes bradycardia, which causes your patient to faint, which isn't a good thing. So that's why you don't want to do that. Another thing is, when you clean this area, you don't want to clean the stoma with alcohol, because what happens is it causes this area to vasodilate the capillaries and they start to bleed. So don't do that. You can just use warm soap and water to clean that area. Basically, warm water will work for most of it. And sometimes you have to get an adhesive remover and remove the extra adhesive around here, and or a protective skin spread thing there. But don't ever use alcohol on this because it's too harsh on the capillaries here and you don't want them to bleed. Okay, I'm going to show you how to do an ace wrap today. And first of all, you want to start with it curled up. You don't ever want to start with it out. And you want to uncurl it like this. So don't wrap it around the arm where you're pulling it like this, because it makes it a little bit harder. So what I'm going to show you on Graham here is the reverse spiral, and I'm going to start at the wrist, and I'm just going to start with a circular thing here, and then I'm going to go up like I'm going in a spiral, but the next one goes down like this, and the next one follows this line right here, so I'm going to follow it up like this, and the next one goes down. This is called a reverse spiral, and the way that you can tell that you're doing it correctly is that it looks starting to look kind of like a braid, if you can see that right there. And it holds really well too if you wrap it like this, and you don't need to pull it around like that. It makes it too tight. Just wrap it normally, and then you can tape it, and then you are going to check the circulation of their hand to make sure they're... Okay, I'm going to show you how to wrap a figure 8 on the foot here, and we'll get it like this. And you're going to start from the distal area and wrap it towards the proximal area, so you're pushing the blood towards the heart. So what you want to do is wrap it in a circular pattern right like this, and let's say the injury is up here a little bit more than down here, so we're just kind of holding it down here, and then we're going to wrap it where it doesn't go around the heel but around the ankle there. You may need to come back down one more time for stabilization and then come back up. That's a figure 8. And then if you continue with a figure 8, if your problem is down here, just keep going back and forth. If not, you can start in on your reverse spiral up here, where you go down a little bit, then you come back up with your spiral, and you go back down, and then come back up, and that will, you can go up as far as you need to, and then you are going to tape it. So you're going to see the reverse spiral right there, and then down here is the figure 8 where you're just wrapping it back and forth like that. Okay.